Hello everyone, welcome to this audio podcast. This audio podcast is part of Equapoise Communal. This audio podcast is part of a Motley Indicate. This audio podcast is part of a Ztorm and Ostix syndicate. This audio podcast is part of the Bookish. This audio podcast is part of a Ztorm Lobostics production. Today looking at a publication, a sort of a literature review. Works by Mohammed and Christine in around 2022. A look at an overview of health inequalities, kidney care for all in support of World Kidney Day 2022. A publication in again in around 2022, and this audio podcast will look at the research gap and research approach and the sort of research and look at research question and strengths and limitations of this publication by Mohammed and Christine from 2022. So in around the research gap and research approach, the publication investigates firstly whether patients or recipients through online consultations and educational support. Whether patients through online consultations and educational support and thus as a way to where the publication investigates whether online consultations and educational support can prompt collaborative efforts, and secondly to understand if and whether CKD recipients would welcome more integrated practices from healthcare professionals, varying healthcare professionals through social media. And as part of the research question, the publication had three main questions that looks at wherein patients and professionals look to look wherein patients and professionals look to bridge gaps in around inequalities, and the publication is within the remit of a scientist's perspective on laboratory medicine and integrated transplant immunology services for CKD recipients. As part of the strength of the publication, one of the main being was that the review was wearing the authors and co-authors represented organizations that have been involved to highlight practices in around and interlinked to awareness through online spaces and integrated practices between patients and healthcare professionals. At the same time of developing the publication, there was referring to literature. And around the limitations of this publication, the design of the publication should have included a case study and or compare with other renal regarding initiatives. That draws this audio podcast to a close. This audio podcast as part of an Equapoise Communal. This audio podcast as part of a Motley Indicate. This audio podcast as part of a Ztorm and Ostix syndicate. This audio podcast as part of the Bookish. This audio podcast as part of a Ztorm Lobostics production.